So here's a quick update on the American measles outbreak, which Johns Hopkins University is reporting as of February 27th this year has now reached 1,194 cases nationally. This number is obviously well out of date because measles is transmitted so effectively and so rapidly. The actual number is probably much higher. The basic reproduction number of measles refers to the average number of secondary cases arising from a single infected person. This number is estimated to be around 12 to 18, meaning that typically 12 to 18 people would be infected by one person with an active case of measles. UNICEF has estimated that measles is about 12 times more contagious than the flu, 6 times more than Ebola, and twice as contagious as COVID-19. And we've certainly been through that already. As I mentioned before, measles can cause permanent deafness or death. In a few cases, about 1 out of 3 children for every 1,000 infected will die. Measles vaccination works, and no, vitamin A, bananas, or ivermectin do not work. Expert opinion is accusing the Trump regime of not taking the outbreak seriously or taking obvious steps to contain it. It's a perfect storm of Elon Musk's damaging cuts to CDC staff, vaccine denialism from senior public health officials like RFK Jr. and Ralph Abraham, the CDC principal deputy director who just resigned in late February, and a public condition by right-wing media to distrust all experts. Although the public seems okay with allowing airline pilots who are experts in aviation to fly the nation's airplanes and meteorologists who are experts in weather and climate to predict snowstorms and hurricanes, so I don't get it. And in addition, there is a deeply held belief among some people that everything that happens is Jesus' will. And this seems to stand in the way of protecting the families of believers. In fairness, the book of Revelation is very thin on recommendations about what to do about measles, so a certain amount of improvising is definitely going on. Deeply held convictions, even if sadly misguided, are not a reason to gloat at the suffering of parents whose deliberately unvaccinated children die of preventable illness, as has happened in recent months. I have seen some really reprehensible behavior like that on social media. The way forward is to respect parents' wish to protect their children and also to explain that measles vaccination was never controversial and always safe until recent bad actors and misinformation have made it a test of political loyalty. In the face of active denialism, a firm reliance on the data is still the best way to go. I mean, after all, these parents still seem to trust airline pilots.